Okay, hi everyone. Thanks for joining us today. 30 minutes, one question, one follow-up, and I'll turn it over to Dr. Williams.
Yes, thank you, and good afternoon. I'm here. Dr. Yaffe is on the Federal Provincial Territorial Committee, discussing a number of issues in there, including monitoring of outbreaks and different systems of case contact management, and other reports that they're generating on behalf of all the provinces and territories from our Special Advisory Committee in our collaboration at the Federal Provincial Territorial meetings. So, the numbers for today, and I'll cover off theirs, we see, as I said yesterday, I was thinking we would get an uptick in the number today, generally because it's 7 to 9 days after a weekend. This is after the Victoria Day weekend. We saw the same thing last Thursday and Friday after the Mother's Day weekend. And so our numbers today are up from the low just under 300 to 383 cases today. That gives us a total of 26,866. So that's 383, nearly up by 90 from yesterday. I'll talk about that in a moment. The demographics are about the same with the male-female split. 40% of the cases are 60 years of age and over. Most ones are in the Greater Toronto area there, accounting for 66% about of the cases. Of those, 82% are in the following three health units. Toronto Public Health with 185, Peel Public Health with 96, and York Region Public Health with 34. The number of healthcare workers tested positive cumulative since the start of the outbreak is now 4,577. We see more recovering, and as I said yesterday, we were over 20,000. So it's 20,673. That's a 77% recovery rate documented thus far. Currently, we have 833 people in the hospital. That's a reduction of 14. The number of people in ICU is down to 137, a reduction of 13. And the number in ICU on ventilators is down to 94. That's a reduction in 23. So those are all positive signs in that regard. Tragically, we still see deaths related to that. We had in report another 34 deaths to our total of 2,189. Our reports in the IFAS documents related to long-term care and retirement homes show that we have 191 active outbreaks. That's down as more are being resolved. 4,964 confirmed cases in residence, and that number seems to be dropping off as active cases, and some are resolving. 1,745 confirmed cases in staff. That's cumulative. All these are cumulative. 1,377 deaths reported for residents and 5 deaths in healthcare workers. In retirement homes, 47 homes are in outbreak, and the number of deaths, there's an increase of 1 reported to a total thus far of 190. On the laboratory testing side, as we anticipated, it's up again today with a total done yesterday of 17,615. That means a total amount so far 662,162 individuals tested in Ontario, or test complete, I should say. And the number tested under investigation at the moment still are 11,868. So I said at the start there, with our number up to 383, was anticipated to some extent. I'm aware also, I became aware that there's still some long-term care survey data coming into the database, and I don't have the exact percentage of what that is. That will take a few days to clarify, so that may be mixed into that number at this time, but the extent of which I can't really comment on there, but there's probably is still more long-term care data residual that's out there that's entering into the laboratory system database and then being re-entered in the Integrated Public Health Information System database. So we're seeing, again, on the testing aspect, the positivity rate in the testing has decreased down to 3% with the 17,615. And it looks like as we usually do on Fridays, where our testing numbers, volumes will be probably going up again tomorrow. So again, people are going out to their assessment centers, are being seen and are being tested. And we would encourage those, as we put out in our memo and our information and announced by the Minister and the Premier, that if you have either symptoms of the wide range compatible with COVID-19, if you've had contact with cases or concern that you have had contact with cases, Or if you've been in essential working situations where you feel you might have been put at risk of contact, you should feel free to contact either an assessment center for a test or at least get advice and recommendations. And you still have the sources of telehealth as well as a self-assessment tool to access if you wish and when you want to do so, as well as looking on our webpage for the locations of assessment centers and their contact number so you could call ahead to make sure that you don't have to wait too long, or we don't want to have big crowds outside of some of the assessment centers in that regard. So that's the general data and information for today, and we'll have more announcements coming up around testing. We hope to in the next day or so. And again, our public health measures table, watching the data, this jump up to the 383 amount after 2 solid days under 300. We have to look at that and see what that's composed of, and does that how's that fit into our overall plateauing coming down, looking at some possible changes and recommendations from our table, perhaps by next week in that regard, in the line of public health measures. So with that, I'm going to take questions from the media. Thank you.
Okay, we'll move to the phone line for questions. Just a reminder, 1 question, 1 follow-up.
First question comes from Sabrina Nanji from Queen's Park Today. Please go ahead.
Hi, Dr. Williams. I apologize if you answered this already. I wasn't able to tune in for the whole time yesterday, but I just wanted to follow up with you after you guys had started keeping track for the multi-system inflammatory vasculitis in children. Have there been any cases or suspected cases recorded, even retroactively?
We were asking, we saw an article about sick children hospital investigating. It is reportable. We're putting out more memorandum and advisories to say if a physician, institution, public health official, or others feel they have a suspected multivascular or multifocal vasculitis related to COVID-19, it is reportable, and we've asked for that reports. We have not received any official reports yet through a reportable disease system, and it may be that the Hospital for Sick Children is investigating at this time to ascertain if they do have cases, and so we'd be looking to be informed by them when they have completed their investigation, and they would report it as per the reportable disease requirements in that. So no, I haven't had any official reports from the sick kids or other centers or other pediatricians or physicians in Ontario yet, but we're watching for that.
Follow-up?
Okay, thank you. And if I can follow up, can you give us the number of what Ontario's medical personnel deficit is? I know Quebec had put out some numbers. I believe it was around 6,000 they were short of people that they needed in healthcare, and 2,000 in long-term care because people are, either sick or self-isolating or too afraid to come into work. So do you have a number for, Ontario's deficit?
No, I don't have that number as a deficit. We have had made known to us a number of other resources, volunteers and different ones, both from federal counterparts. Depends on which type of profession you're looking for. We have, of course, accessed the Canadian Armed Forces, as the Premier noted, to assist in long-term care. And the long-term care sector has been assisted by a number of hospitals, and there's agreements have been made to give that coverage. So the IMS table for long-term care continues to deal with that issue there, but we have not been alerted to that, as of course our hospital systems have been the occupancy is down and the emergency load is lessened, and we're just now ramping back up with a change to Directive 2 to allow a number of the other healthcare services to start picking back up again. So I haven't been alerted about shortage per se, but we have been made aware of other resources we can go to if we want to obtain those. But we can try to get back with some number on that, but we don't have that equivalent number, what you're quoting from Quebec, here in Ontario.
Next question.
Next question comes from Julianne Lamoureux from Radio Canada. Please go ahead.
Yes, good afternoon, Doctor. Yesterday, the Premier of Quebec, François Legault, asked as Chief Medical Officer of Health, why was Toronto doing so much better than other cities in North America, and Toronto is doing better than Montreal? He didn't give an answer yet, but I was wondering if you wanted to give us your take on the situation.
I just heard the quote, and I didn't have done any comparison with other large cities in North America. on how they've undertaken this. And I think probably what he's alluding to is that our greater Toronto area, with its population between the city with the 3.5 million and the greater surrounding area of another 4 to 5 million, I would think our comparison is much similar to larger centers like New York City and that. I haven't done a comparison in that regard. I think it's a bit early, especially comparing to our American counterparts. They're still in the midst of their first wave, if you may, and coming out of that. I think it's presumptive to conclude, in my mind, if we're that much better. I'd rather have our academics and our Public Health Ontario people look at some comparisons. The cities are all a little bit different, but I think in the size, and that's what I've been trying to emphasize, we're in Ontario with our large multicultural, very much international hub of the Greater Toronto Area is unique in Canada. Montreal is somewhat similar, and as a result, I think it has its challenges. And we've talked about that with the amount of people moving in and out, large numbers coming internationally in and out of Toronto every day before the shutdown. And so we face some of the same stresses that the others face in that. I think it may speak to some of the strengths of our structures with our local health units, such as Toronto and Peel and York, where they are engaged and they have a very much robust, very, I would say, very complicated and yet very functional case contact management systems, utilizing their infrastructure and their integration in their upper tier government structures with their municipal counterparts, bylaw officers. So they have ability to move fairly quickly and do that, and they have a lot of staff trained in with many languages. So I would probably give the credit to a number of our local health units, and that's one of our strengths in Ontario, that our local health units are equipped to take our provincial data, and then they add much more to their local level, and the granularity they can go to in the, I would say, the intensity and the quality of their investigation is quite excellent. And so I think that's been all part of that contribution, but I would be premature to conclude that we're that much better than other North American cities. I have not done that data, or nor have I asked for that comparison, but it's nice to know that the Premier of Quebec has recognized that.
Follow up?
Thank you. I'm good.
Okay, next question.
Next question comes from Nicholas Haddad from Radio Canada. Please go ahead.
Hi, Dr. Williams. Thanks for taking my question. So I wanted to ask, earlier today, Premier Ford suggested that back in April, inspectors refused to go into nursing homes during the peak of the pandemic. He says that this was largely a union-led issue and that only the union was able to convince inspectors to go into the homes eventually, which they did. I just want to know, what's your take on this? Specifically, do you think the delay in getting inspectors into long-term care homes was a factor in where we are today in the fight against COVID-19 in Ontario's long-term care facilities?
Well, I think the inspectors they're talking about are the ones with the Ministry of Long-Term Care, and I don't really know what that, I'm not detailed because I'm not with that ministry per se, and what that history was. So it would be it was irresponsible for me to comment on that at this moment until I had consultations with the deputy minister in that ministry, as well as others to comment on that. So I just know that we were dealing with with a lot of our long-term care, and our numbers were quite low early on, and then when we went through our large influx and we had large community spread starting after the March break, things started really ramping up there with some staff infections and further ones in certain homes. So I was more looking at it from that standpoint of when we started going a much wider community spread following the large inflow of people, Ontarians, returning from what they assumed was an eastern seaboard of the U.S. that was not infected by COVID-19, because at that time it was only Washington State and California. But I guess we found out later that they had been infected, and that caused some changes. So I can comment on that, but I can't really comment on the inspectors with the Ministry of Long-Term Care and their activities during that time.
Follow up?
Thanks very much for that answer. We're going to switch tracks for the second question, which is just, keeping in mind that gatherings are still restricted to groups of no more than 5 people, do you have any additional insights we may not have heard already regarding whether people should be gathering outside as opposed to inside?
Okay, our public gatherings are still at the 5, and we are asking people still in the household groupings to stay in those, to stay home, or if you're out, keep your 6-foot distance. So an indoor gathering of a family that's always been together, that's what they've been doing. To have other public people into other gatherings inside, that's still not what we're recommending. As you can see with our number at 383, we were trying to get down below, we used to talk about weeks ago, under 200, and I'm still trying to drive down there to have a look at that. So we still have evidence of community spread, and so our public health measure table has not encouraged gatherings of public people in groups of more than 5, and even the public gatherings are supposed to be respecting the 6-foot distancing and or wearing cloth masks if they feel they are unable to maintain that 6-foot distancing, whether that's indoors or outdoors, is the same standard. So family units that have been doing it all along, that's fine, but not public.
Next question.
Next question comes from Derek Dionarain from CBC News. Please go ahead.
Thanks, Doctor. So this first question is for Dr. Williams. Toronto's Medical Officer of Health released which neighborhoods are hotspots for COVID cases yesterday. Brampton is going to do it too. So why are you not releasing the hotspot information for Ontario as to where the pandemic is the most active?
So as I said in the comment about the city, I think one difference that Ontario has compared to some other parts of the country is that our public health units with medical officers of health and their staff, they have provincial data, but they have all the IFAS data for their jurisdiction. As a result, they're doing many layers of different type of investigation. And I've been impressed how one will do something quite different from the other, and their data will be different from one from the other. We had asked for some early to see if Toronto had some geospatial mapping, and they did. But their lead in that, underneath Dr. Villa, had said strongly, please do not release this. And if we were going to, we would do so because the communication is very critical so that it would be interpreted in the correct way and not stigmatize certain populations. So we respected the local unit, in this case Toronto, and Dr. Davila and her team, and they could release it as they wish and how they would like to interpret it because it is their jurisdiction and their responsibility. York Region, on the other hand, when we asked the same question, their medical officer of health said, we have no clustering geospatially in that. And we've checked it, we've looked over it, we don't see that. Peel said, well, we have some in these areas here, and their acting medical officer of health, Dr. Lowe, has talked about doing some further release of information there. So different health units have some difference depending on their social demographic as well as their physical layout, and some are dealing with more with institutional outbreaks. The key they're looking at is where's the source of infection coming from, so that you may be commuting and getting it from a workplace where you reside is where the test is recorded, but that now may not be where you obtained it from. So the key is we're trying to look at is where are people acquiring it from, because of their social distancing, you have to get it from somewhere and from someone who is in that setting. So you may have been put into a setting or location where you lost that type of distancing and where you have been either knowingly or unknowingly been exposed. And if you were, maybe some other people. So the difference here in Ontario is that our staff and our public health units are going out looking for outbreaks, identifying cases. So they're doing case finding, not just responding to lab tests only. And so as a result, we have a lot of outbreaks reported at this time. I got some recent data, and it's not even up to date. Some are resolved. We have close to 1,000 outbreaks, including long-term care homes, that public health units have identified related to COVID-19 already. That shows you the dynamic work of the local health units in their respective jurisdictions, and there's probably more than that. So that's why we didn't release it. One is they asked us not to, and they wanted to release it themselves, and each health unit will do that, each medical officer of health, as they feel they need to, as they feel it assists them in dealing with COVID-19 in their respective jurisdictions.
Follow-up, and this is the last question.
So how does just to follow up on that, how does the province plan to track and focus on community outbreaks now that more businesses are reopening and more people are starting to return to work?
So that was just what I was saying. In the health units, when you get a case, besides asking the contacts, you also want to know where was the person the last 7 to 14 days, or more than 7, that's the incubation period, and what kind of areas had they been in. Have they been in a work situation? Have they been in a community social activity? Were they in a retailer? And you find that person, and meanwhile, the other staff member of yours is to follow another case, and they said they were in the same location on the same day. And you talk to your public health inspection staff who do a different role, and they said, we're aware that that situation, that store, that there was a whole crowd, they announced some sale, people did not adhere to spacing, they did a whole bunch of things on that evening from 7 to 10 p.m. Then you put out information to your public saying, if you're in this facility between 7 and 10 on this day, we need to hear from you because you need to be tested. You are probably in a high-risk situation because we've already identified X number of positive cases. So you will start to do that case finding and identify those sources of infection, not just the people with infection.
Thanks, everyone.